Namaste, hello, and good afternoon. Welcome to the Recover series presented by Apollo Hospitals. Dr. Srinidhi Chidambaram here. The Recover series brings to you twice a week the most relevant and pertinent information for those who have had COVID-19 to recover and regain their health and well-being. So how have you all been as we hear of a lot of new variants, and also there has been a lot of talk about a looming third wave? For us, we just need to remember one thing. The ground rules for us remain unchanged. It is always going to be our SMS mantra, which is the social distancing, sanitizing, and wearing the mask all the time, and of course, getting vaccinated. I hope that most of you would have had at least one dose of the COVID-19 vaccination by now. Do so now. One aspect of COVID-19 involved muscle and body pain. We know that it is a common symptom, not only in COVID-19, but also in many viral infections like the flu. We also need to be aware of how to manage this bone and joint and body and muscle pain during COVID, and also differentiated between viral myalgia and also other causes of joint pain, and also from other orthopedic and autoimmune arthritic conditions, which can also get aggravated during a COVID-19 infection. And in fact, even during the recovery phase, we see a lot of people having muscle, bone, joint pain, which may be part of the long COVID syndrome, or it might be even aggravating existing autoimmune arthritic or orthopedic issues, or it might even be, in some cases, other complications like avascular necrosis, or even other aggravations of existing orthopedic conditions. We are seeing, and orthopedic doctors particularly are seeing, a variety of these bone and joint related presentations in the post-COVID phase. How can this be addressed, managed, or prevented? To enlighten us today on all these aspects, I'm very happy to welcome Dr. KJ Reddy, who is the Chief Joint Replacement Surgeon, Apollo Hospitals, Jubilee Hills, Hyderabad, and a very eminent and senior orthopedic and bone and joint surgeon. Dr. Reddy specialized in joint replacement surgery, complex primary and revision hip and knee surgeries, sports medicine and arthroscopies of the knee. And he has organized several conferences, given many lectures, and has done live surgeries as demonstrations in several international conferences and forums. He has been a consultant in the Basildon and Thurrock NHS hospitals in UK, completed his senior rotation from the St. Barth and Royal London Hospital in UK, and he has spent over 14 years in the UK practicing. He has been a board member of the Arthroplasty Society in Asia, chairman of the Fellowship Committee of the Indian Arthroplasty Association, president of the Telangana Orthopedic Surgeons Association, president of the Indian Arthroplasty Association, national faculty of AO Recon, AO Trauma, IAA, and other associations, and has also published innumerable articles in national and international journals. Welcome, Dr. Reddy. Thank you so much for joining us on this COVID recovery series. I do hope that you will be able to guide our viewers on what to expect regarding the bone and joints and muscles in the post-COVID phase and how to manage them. Over to you.
Namaste. Good afternoon. Thank you very much, Dr. Srinidhi Garu, for your kind words. I'm privileged to be part of this series from Apollo Hospitals, Hyderabad. And as you rightly said, day by day, we are seeing a significant number of people post-COVID symptoms, especially affecting bones, joints, muscles, which is affecting their day-to-day activity, day-to-day work. But what I want to convey initially to the people affected by COVID, do not get worried, because that increases your problems. We have treatment, we have solutions. Most of these problems can be treated, and you can have normal life once you recover from these symptoms. And I want to stress again, everybody should have vaccine. That's the most important weapon we have. And again, masking, social distancing, hand sanitization, we should not forget. Thank you once again. I think through this session, we will take up one issue after the other and we'll discuss accordingly. Thank you, Dr. Srinidhi.
So, Doctor, can you first explain how COVID-19, even during the active phase of the infection, what are the bone and joint problems or muscle issues that people may have?
Yes, they have multiple problems affecting muscles. Muscles mainly weakness of the muscles, and post to COVID patients, they cannot walk reasonable distance. They're finding it difficult to stand for a long period and difficult to sleep in one position, and probably their sleep is also disturbed, because what happens is during sleep, sitting, any position, we have to have certain tone in the muscles to maintain our body posture, which is affected by this in some of the patients. And also it's affecting joints, giving pain in the joints, especially during night time. And what happens is, because of these things, their quality of life is affected.
How long do these symptoms last in the COVID phase? Like, when they are actually actively in that first 10 days, how long do people have these myalgia and all that? And what can they do really to get rid of it or to manage it at that phase?
Sure, this is a very good question, because the truth is nobody knows how long it's going to last, because we are only maybe 18 months down the line. But most of the time what we observe, and more recent publication has come from UK saying that these symptoms, majority of the symptoms will subside 3 to 6 months. Majority, but some may not, especially the avascular necrosis of the femoral head, which needs treatment. But most of the symptoms, if you take care, see a doctor, take medication, physiotherapy, rehabilitation, majority will go away in about 3 to 6 months time.
Can you tell us a little more about what kind of physiotherapy, or like when they have these prolonged muscular aches and weakness, could you tell us a little more about what kind of rehab is given for these kind of patients?
I think for the bones, muscles and joints, the best medicine is exercise. Nothing will replace exercise. But people affected with COVID, what happens is their muscles are weak. So they have to be careful. They should not overdo it. What happens? Muscles easily go into fatigue. So they should have monitored, controlled increase of their activity, simple exercises, because joints need nutrition, and the nutrition comes from mobility of the joints, because joint surface doesn't have blood supply. So we have to keep joints moving. Passive range of movement, they can move without any weight exercises, move all the joints, knee, hips, back, upper limbs, so that the mobility of the joints is maintained, which will reduce the stiffness, and also it increases the strength of the muscles, and also increases strength of the bone, because that will keep good circulation and strength of the bones and joints.
So some people say that, during the recovery phase, they develop joint pain, particularly they say they have knee pain. So how does this get managed in the sense, what should they do? How long should they immediately see an orthopedic doctor as well? Or and what are the common joints which are affected in this post-COVID phase?
Yeah, I think that's a good question again. What happens is most of the viral infections affect joints. They don't infect the joints, but there's a condition called reactive arthritis. Because of the immunological response, body produces some of the antibodies which will act or damage our own joints because of the autoimmune response. Most of the virus, especially chikungunya, is very bad in affecting the joints. So not only chikungunya, many viruses will affect the joints because of this immunological inflammatory response. During the active COVID stage, they will complain of joint pains and muscle pains. So the mainstay of treatment would be anti-inflammatory medication. good medication and exercise. Complete rest is no good for these muscles. Little exercises as they are allowed. And of course, some of these COVID patients might need steroids. Steroids will also reduce the inflammation and control the symptoms of the joints. The duration, generally what happens is maybe 10 days to 2 weeks, they can take anti-inflammatory. After that, they can take simple painkillers like tramadol, paracetamol during active stage. But they will come back with post-COVID orthopedic symptoms, musculoskeletal symptoms, and we have to decide case to case basis what kind of symptoms they have, any particular reason what they have, and based on their clinical and other assessments, we have to decide their medication. Along with anti-inflammatory, they need some other medication to support the system.
You were talking about avascular necrosis of the head of the femur. So could you tell us a little more about this? And, because not many people have heard of this complication of COVID. So would you just elaborate a little bit on that, Doctor?
Sure. Avascular necrosis of the femoral head. What happens is, it's a known condition, and even now we do not have a good solution for AVN of the hip, even before COVID. Commonly before COVID, commonest cause of AVN is steroid usage, alcohol abuse, inflammatory conditions like rheumatoid arthritis. In India, post-trauma, if head comes out the hip joint and puts back the blood supply, it's a slow loss of blood supply to the femoral head, which will cause a necrosis of the femoral head, leads to arthritis of the hip joint. And in case of COVID, and I'm sure you're familiar, we are the one pioneers in regrow, where we implant a bone implantation with autologous marrow cells, and we are the first one stopped in India. Apollo Group patented with regrow company and started, and we have, as Apollo Group, we have done maximum number of treatment for AVN of femoral head for young patients. And the problem with this is most of them are young patients. They are earning members of the family, and its entire family is affected because of this condition. In COVID, what happens is, well, as we heard, there is microvascular thrombosis in the femoral head, which will slowly reduce the blood supply to the femoral head. That will lead to AVN. That's one of the theory. And the second theory, majority of the people who had a severe disease had steroids. Steroids is well known to induce avascular necrosis. So it could be one of them or combination. And we have seen quite a few. This morning clinic, I've seen 3 people, one with bilateral AVN, 2 with single one-side AVN, post-COVID effect, especially the second wave. So we're going to see more and more these people affected by avascular necrosis, because the use of steroids, as you know, was significant where inflammation was more. So I think we're getting more. But what happens is, if we can diagnose early, there's 4 stages, stage 1, 2, 3, 4. Stage 1 is a beginning stage. Stage 4 is arthritic stage, where there's no option apart from hip replacement. Stage 1, 2, 3, we can treat without replacing the hip joint. We can transplant their own cells in the form of osgrow or regrow, where we take their own stem cells, grow them up to 48 million cells, and reimplant into the femoral head, which will prevent further damage, and possibility it might repair the damaged head, restoring the blood circulation.
What about autoimmune conditions? Autoimmune conditions during the
yes,
COVID period? What about people who already have rheumatoid, or they have other autoimmune arthritic conditions? How do they do? Do they have worse symptoms during COVID, or are they just like other populations? And what are the sequelae? Do their arthritic conditions get worse?
Yeah, absolutely. I think that's a very good question again, because most of the arthritis, either osteoarthritis or autoimmune rheumatoid arthritis, they get worse during any viral infection, because these people already their muscles are weak, their mobility is less, which is more important to keep the joints healthy and pain-free. So virus, what happens is there is no direct infection of virus into the bones, joints, or into the muscles. Till now, nobody isolated the virus from the joints or the muscles of the bone. It's only the antibodies or auto antibodies, immunological response to the joints, which will damage the joints, make the muscles weak and bone weak. We don't know the exact mechanism. I mean, so many studies are there, but the exact cause is not known. How the COVID affecting, we know it is affecting, but most likely we think it is something like autoimmune response. And the symptoms of rheumatoid arthritis, especially those affected by autoimmune diseases, is aggravated. Their arthritic symptoms, they need more medication, more painkillers, and they need more rehabilitation following COVID infection.
We also have seen some people saying that after they recover, they start having pain in the small joints.
Yes.
So is this a sign that they are developing some autoimmune condition, or it's just a part of the post-viral myalgia?
We are not sure whether it is autoimmune, whether they're going to be permanent. But yes, you are absolutely right. Some people develop, like rheumatoid arthritis, develop pains in the small joints, especially hands and wrist. And what we feel is it is part of reactive arthritis, where reactive arthritis is very commonly known after any kind of viral infection, more in case of chikungunya, but probably it could be in COVID as well.
Are there any ways of, like supposing somebody, of course, we have to take all measures to not get COVID, but prior to the whole thing, like we say that, people with poor sugar control have more complications of COVID. Like that, is there something which people can do to strengthen their bone and joints so that, even if they get COVID, is there some way that they can get away with, a milder thing? Is there some way to strengthen or keep the musculoskeletal system in peak form?
Yes, I think two things, because COVID itself, virus itself will weaken the muscles, joints. And the second is we need some degree of inflammatory response to protect our joints. And using of excessive steroids will prevent that. And excessive steroid also will cause problems with the joints, muscles, and bones, because it's known to cause myopathy, known to cause osteoporosis. It also affects the joints. So the combination of, so we have to be very careful. Those who do not need steroids, better to avoid them and use anti-inflammatory. Of course, if life-saving condition, they have to use steroids. But if it is not required, there's no point in using them in excessive dose. Rehabilitation is the most important part, because orthopedic care, musculoskeletal system, prolonged rehabilitation. They have to start. Complete rest is no good, but excessive exercise also not good. That should be balanced and monitored. And a patient is the best person, because if they feel too much of pain, they should not do it. But initially, when they start doing exercises, the pain will increase a little bit. It will come down with anti-inflammatory. They are so, the pains will go down. And it will be much less over a period of time. Most important thing, as you rightly pointed out, is strengthening the muscles and keeping the joint movements intact. So you should do range of movements exercises, not weight training exercises, but you put the joint through full range of movement so that it will keep its mobility and avoid stiffness.
What about the elderly, doctor? Like, when the elderly people get COVID, a lot of them also may be having, like probably some form of arthritis, osteoarthritis, or osteoporosis. A lot of people developed poor bone density and weak bones. So do you see a lot of post-COVID bone and joint complications in the elderly, or is it, what is your experience?
I think because most of these people, we see young population, this time especially young people have come, and elderly people, their symptoms get worse, but they're not long-standing. Most of the time during the period, and maybe a little longer, and reasonably controlled. During second wave, because most of them are vaccinated and stayed at home, so we did not see too many elderly people following second wave. Majority of them are between what is that, 30 to 50, 30 to 60 age group.
Doctor, now, is there anything else that you wish to add? And then after that, we will look at some questions which are coming to us on the live feed. So if there's anything else, like, you know,
Sure.
like
I want to make one thing.
word of advice to our viewer.
During COVID, what happens? Most of the people, orthopedic patients waiting for elective surgery are being delayed or postponed. And we, to some extent, they were not looked after well, in a sense, because of various reasons. They did not come to hospital. And so what happens is, those who are going for elective operations, they should, I think, get vaccinated. And there's a lot of doubts about vaccination. You can have orthopedic operation following vaccination, and painkillers, anti-inflammatory we give. You should not take anti-inflammatory following vaccination, maybe week to 10 days. Afterwards, you can take anti-inflammatory. So it's quite safe to have elective operations following COVID as well as vaccination. And I should warn people who are affected by COVID, if they're coming for elective operations, you must tell your doctor that you had a COVID infection, you're treated, what level, whether you had steroids, so that we take extra precautions, because the complication rate is a little higher, especially thrombotic complications. They have more chance of DVT and PE. So we have to take all the precautions. We have to put them on a prophylaxis. So they have to inform us, and we take accordingly. And they have to wait minimum 4 to 6 weeks after infection to go for any elective operation, typically. And people who already had operation for any elective or any injury, fracture fixation, if they get within 3 to 4 weeks, if they get COVID infection, the morbidity is a little high. So they should also consult, and they should inform the physician that I had operation recently, because following any operation, there will be inflammatory response. COVID also induces inflammatory response. So combination, probably the risk is high, especially the vascular complications are high. So they should take measures, preventive measures, as well as appropriate treatment for that particular problem.
We'll now look at some questions which are coming from our viewers, Doctor.
Yeah.
First one is, how do we manage inflammation in the joints right at home?
Yeah. So the best way of managing inflammation, we should have short duration of anti-inflammatory medication. Along with that, gentle exercises, hot or cold application. You can alternate heat as well as cold. Some people feel better following cold application. Some people feel better after hot application. So your choice. And gentle physiotherapy. There's so many physiotherapy equipment like shockwave therapy and all those things if major joints are affected. But rehabilitation is very, very important. Complete rest is no good for the joints. That's the message I want to pass on. Any mobilization, they should walk as much as they can do and mobilize the joints. And the exercise is the best medicine.
Absolutely. I recovered from COVID long back, but I'm still having regular pain in my hips.
Yeah.
Can you please suggest how I can get rid of the same?
Yes, I think this is a very important question, and everybody should be very careful. If they mean hip pain, it's not back pain. Hip pain generally comes in the groin and around the upper part of the thigh. So if you're affected by COVID and if you're treated by steroids, you must exclude necrosis of the bone. That's a necrosis of the femoral head. You must see your orthopedic surgeon and preferably get an MRI scan. And if it is diagnosed in the earlier stages, stage 1, 2, probably we can see your hips.
So important thing is to not to ignore it.
Yes.
And to see the orthopedic doctor. Yes. The next question is, how can I avoid joint pain flare-ups post the COVID-19 infection?
Prevention.
To avoid, prevention of joint pain flare-ups in the
I think what happens is some degree of joint pains, because the symptoms itself, one of the symptoms itself is myalgia, body pains, joint pains. So probably you should take anti-inflammatory under supervision, and anti-inflammatory short duration is very good. but we should not continue more than a week to 10 days, especially those suffering from blood pressure, diabetes, because their kidney function is already not very good. So you should consult your doctor, take this anti-inflammatory medication, and do these hot fermentation or cold fermentation, gentle exercises, little massage, not manipulation, little massage, and exercises. If you have a good physiotherapist, take advice from him. Gentle mobilization of the joints would, I think, prevent or avoid severe symptoms later.
I was affected with COVID-19 this month, no, in the month of May, sorry.
Yeah.
But still, I'm unable to stand or walk. I have severe muscle pain. I have undergone the CPK-MB test, which was 208. Please suggest.
Yeah, I think this is a very valid question, and quite a few people complain about this fatigue, muscle pain. I think these people will recover. It might take longer. Sometimes it may take up to 6 months. The important thing is not to get worried, because part of it is coming from the brain. If you think too much about it, it will get worse. So you take a good physician, orthopedic surgeon opinion, and rule out any other cause. Most of the time what happens is some of the post-COVID patients, they neglect, they miss some other diagnosis, which may be treatable completely. They think it's because of COVID, I have this problem. So don't make yourself that kind of assumption or diagnosis. See physician or orthopedic surgeon, rule out any other cause for this problem. If it is purely because of post-COVID, then we can treat it.
My friend is 60 years old. He got affected with COVID-19.
Yeah.
Post-recovery, he's still having heavy pain in both the hands. How much more time will it take to recover? Can he do any specific exercise or home remedy?
Yeah. This age 16, isn't age 16 affected by how long ago, Dr. Srinidhi?
It doesn't say how long ago.
Okay. I think probably 16-year-old, I think it affects the small joints, as we discussed in the beginning. That, what happens is it will go away. He needs some form of anti-inflammatory medication, short period, short duration, and gentle exercises. You can take a stress ball, keep squeezing it, and put some ointment, analgesic creams. And if it doesn't go away within few days, you must consult doctor, because we have seen many people taking treatment from social media, from Google, self-medication, their friends' advice. I must say they are not the best doctors. They are good to communication, but they are not the best doctor. When it comes to the medical advice, you must go to a professional doctor.
The next question, I'm having heavy joint pain in the legs post-recovery from COVID-19. Can you please suggest the best remedy to recover from it, or will I recover without medicines?
Yeah, I think, as I said again, if we have to decide first thing, it is because of the COVID. How we decide? We do the test, rule out other issues, maybe other problems which have come up during this time. It may be coincidental. So you must see a doctor and see if it is knee pain. It could be osteoarthritis, which got worse by viral COVID infection, or it could be any other problem. Sometimes back problems can affect the legs, or it could be hip problems. It could be due to necrosis. So you must consult, because most of these people do not go for self-medication. You must consult the doctor, take appropriate investigations, and take appropriate advice as well.
Hello, doctor. Can you suggest any supplements or protein shakes to improve bone strength post-COVID infection?
Yes. I think if you open the media, there's so many supplements and you get confused. The best supplement, what I can do is fresh vegetables, glass of milk. If you eat eggs, maybe egg white, some dry fruits. You can take up to 15-20 dry fruits. It's so many available nowadays. That gives very good protein, because protein is very important in muscles and bone. You can take peanuts, not big quantity. The best way is over a period of time, small quantities every day, you take regularly for maybe next 6 months, 1 year, and good nutritious diet. That's what I think will help your supplement your proteins.
Can non-steroidal anti-inflammatory drugs, which are often prescribed to treat arthritis and joint pain, can they worsen the COVID infection?
No, that's not true. They will not, because in COVID, severe COVID, there will be inflammation. So it will reduce the inflammation, because as we understand, COVID is mainly inflammatory response. It's not directly viral response, inflammatory response that affects lungs and other parts. It will reduce, and we have to be careful, because those who have impaired renal function, we have to monitor. Those who have gastritis or GI symptoms, we have to take appropriate antacids, and it should be short duration. If we take short duration, the long-term effects won't be there.
I think, as you rightly said, this is the best way is to consult a professional and get the right advice on the duration of medication, what kind of anti-inflammatory. So these need not be worrying the patients. They don't have to decide it. I think if they can just consult a good orthopedic doctor and their physician, they should be able to guide them and all these things.
Absolutely, because they might have other associated conditions. So we just give advice, which is the best one, because there's so many hundreds of anti-inflammatory are available. So we should decide which suits them best.
My shoulder joint is paining a lot post COVID-19 infection. Can you suggest some remedy for it?
Yeah. Shoulder joint, because what happens is if we have a pre-existing shoulder problem, it will get worse post-COVID. And most of the time, if we young people, it may be due to trauma, which was there, and because of muscle weakness, shoulder has come up. If it is elderly people, common problem is rotator cuff problem or tendon problem, which has come in light because of the COVID infection. And we have to rule out this one. The best way is see your orthopedic surgeon, get an MRI scan if it is long-standing. Then we can decide if there is no problem inside, there's no structural problem, because in COVID infection, there is no structures are normal. It's only inflammation that causes symptoms. So then we can treat. If it is purely COVID, post-COVID, it will go away. Most of the joints will go away. Many people will get better in 2 weeks. Maybe some continue 6 weeks. Some maybe as long as very few people will continue up 6 months.
Post-COVID, does the existing osteoarthritis worsen? If yes, what is the cause for it?
Yeah. What happens is it has been shown any viral infection will increase osteoarthritic symptoms. Probably the disease itself may not get worse, but the symptoms will get worse, because the COVID affects muscles. Muscles become bigger because you need good muscles to support your knee joints. What happens in when you're walking, it takes about 6 to 7 times of body weight passes through the knee joint. When you're going up and down stairs, 12 times of body weight passes through the knee joint. When you sit on the floor, get up, 18 times of body weight passes through the knee joint. So what happens is, if you put on weight during this time, or your muscles are weak, your knee symptoms will get worse. So you have to sort that one out first. If it is because of COVID, majority of the time, it will go away with time, with anti-inflammatory physiotherapy exercises.
This is the last question, doctor.
Yeah.
After post-COVID, I'm suffering from left leg knee pain.
Yeah.
Especially when I'm using the Indian toilet. So how can I get rid of this pain?
Yeah, I just said that sitting on the floor, getting up puts 18 times of body weight. So your 50 kilos, it puts 1800 kilos on the knee joint. So first thing is avoid sitting on Indian toilet. Use commode, Western commode, and you should height. If you're reasonable height, if you're about 5 foot 6 inches, you should have 18 inches height of commode. That will prevent the symptoms. And of course, you have to do exercises. You have to take appropriate treatment for osteoarthritis, which is, it's very advanced nowadays for a knee. Nobody should suffer with the knee pain because of osteoarthritis, because we have all the remedies at various stages. So I think you should consult a good orthopedic surgeon.
On that note, I'd like to say thank you, Dr. Reddy, for this very wonderful and practical suggestions to people on what they can do to mitigate their bone and joint symptoms in the post-COVID period. Thank you so much for joining us. Thank you, viewers. And if you have any more queries, you know that you can put your comments and queries on our Facebook page and also inbox us your messages. And please also know we have a YouTube channel, so please look at that for updated and constant authentic health education and awareness sessions. Our next session will be on 16th of July, that is the coming Friday at 2 p.m. So we're going to talk about the topic of would regular preventive health checks help in fighting COVID-19? And this will be discussed by Dr. Rama Narasimhan from Apollo Hospitals, Chennai. So till then, I'm sure you'll stay safe, and don't forget not only the SMS, but also the 5 W's of COVID-19, which is what, follow those COVID safety measures when, every single time. There are no exceptions. Where, everywhere, wherever you go, who, everyone has to follow. Nobody is an exception. And why? Yes, to stay protected and safe from COVID-19. Take care, be safe. Thank you and namaste.
Thank you very much, Dr. Srinidhi Garu, for your excellent moderation. Thank you.
Thank you.